This is part 3 of our audio lecture on body composition and application. So now that we have the data, we can estimate our body fat percentages. So there's different abbreviations that you might find. BF usually stands for body fat, and DB stands for body density. Skin fold, or is sometimes referred to as SF, and SSF is the sum of skin folds. These are things that you're going to see within your lab. So in our lab, we're going to be able to calculate an estimated body fat percentage from the skin folds. We're going to use the Jackson-Pollock 7-site body density equation to calculate the body density, and then we're going to use the answer from the body density and plug it into the Siri equation for percent body fat. These equations will be provided for you on the lab and are also provided in this lecture. So we talked a little earlier about all different assessment types having an error. This chart just tells us the approximate standard error of estimate for each of the different methods. So for BOD-POD, the standard error is usually plus or minus 2.2 to plus or minus 3.7%. Bioelectrical impedance, plus or minus 3.5 to plus or minus 5. That's an error in the chart. It shouldn't say equals. The DEXA has an error of plus or minus 1.8%, skin folds plus or minus 3.5, and underwater weighing plus or minus 2.5. These are the equations that we will utilize on the lab to get our Jackson-Pollock 7-site body density for both males and females. These are provided on your lab, but I just wanted to give them to you here as well. Once we have our body density number, we can plug it into the Siri equation or the Brozek equation to estimate our percent body fat. So these are two equations that we can utilize. They differ slightly, but have the same principle. Here's an example of a chart that we can utilize to interpret leanness or of each person based on age and their percent body fat. Common equations that you're going to run across when determining body composition, as we already kind of talked about, the Brozek and the Siri both look at body fat, but we need to know body density first in order to compound those. So the Jackson and Pollock body density 7-site skin fold is what we're going to utilize, and those equations are included below. In this lab, we're also going to be recording some circumference measurements. So here are procedures when taking circumference measurements, and these are pretty standard. So all measurements should be made with a flexible inelastic tape measure. So it should be movable so that we can lay the tape measure across the contours of the body. The tape measure should be placed on the skin surface without compressing the subcutaneous adipose tissue. So we don't want it to be pressing into the skin, just laying on top of the skin. We want to measure to the nearest millimeter and take duplicate measurements at each site and retest if the duplicate measurements are not within 5 millimeters. Same thing with our skin fold sites. We want to rotate through different measurement sites to allow the skin to regain its normal texture. We're going to talk through some standardized descriptions of circumference sites and procedures. So one of the most common is abdomen. So you want to have your subject standing upright and relaxed. A horizontal measure is going to be taken at the height of the iliac crest, usually at the level of the umbilicus. So you can have the patient put their hands on their iliac crest just to kind of give you a landmark, and then we're usually going to be at the belly button when taking an abdominal measurement. When we're taking the measurement of the arm, the subject is going to stand with their arms hanging freely at their sides, hands facing the thigh, and then we're going to take a horizontal measure midway between the acromion process and olecranon process, very similar to how we took our skin fold measurement. When we're looking at the hips, this also includes the buttocks. So you're going to have the subject stand, feet together, We're going to take a horizontal measure at the maximum circumference of the buttocks. And then this is used for the hip measurement when we're doing a waist to hip, which we will do. And then if you were to take a calf measurement, you'd have the subject stand with their feet slightly apart, take a horizontal measurement at the level of the maximum circumference between the knee and the ankle. Additional circumference measurements, we can take the measurement of the forearm, so arms hanging at their sides, slightly away from the trunk, and palms facing forward. And the measurement is going to be taken perpendicular to the long axis at the maximal circumference. So wherever it's the widest or biggest circumference, that's where you're going to measure. For the hips / thigh, the subject is standing with their feet slightly apart, and a horizontal measurement is going to be taken at the maximal circumference of the proximal thigh. So this is going to be below the gluteal fold. This is going to be just one limb, not at the waist. So just below the gluteal fold, kind of where that bathing suit line might hit on a female, that's where you're going to take the measurement. You can take a mid-thigh measurement, which you're going to have the person stand and put one foot up so the knee is flexed to 90 degrees. And then the measurement is going to be taken between the inguinal crease and that proximal border of the patellar. So this mid-thigh is going to be in the same position as we would take our skin fold, except that we're going to have their foot propped up and their knee bent to 90 degrees. And then for our waist, we're going to have our subject standing, arms at their sides, feet together, abdomen relaxed, and we're going to find the narrowest point of the torso. So above the belly button and below the xiphoid process. Okay, and we're going to measure that for our waist. So there's different formulas and different sites that we talked about earlier, but for our purposes, we're going to take the narrowest part from above the umbilicus and below the xiphoid process. In addition to our skin folds and circumference measurements, we can also calculate our basal metabolic rate. This is the amount of calories that we burn just doing our daily bodily functions. So we are able to calculate that rate utilizing our lean body mass in kilograms, and we can figure out our lean body mass by taking our body weight in kilograms and body fat percentage in order to calculate that. Knowing our BMR and our physical activity levels, we are able to calculate daily caloric needs for our patient. So the chart tells us the activity level, and then we would take our BMR and multiply it by the specific number in the equation. When we're talking about exercise, that's 15 to 30 minutes of elevated heart rate activity. Intense exercise is 45 to 120 minutes of elevated heart rate activity, and very intense exercise is 2+ hours of elevated heart rate activity. So we want to make sure to use those classifications appropriately when we're calculating our caloric needs based on activity.